Hey guys, what's happening? Good to be back with you in Barbados. Well, Barbadians are upset today. They are angered and they're wondering why their government did not inform them that the country had a case of the West Nile virus and they had to be informed by the WHO, basically exposing the government, all right, for keeping this information to themselves. It's almost like a blatant cover up, but why did they do it? But that's the problem. I'm always saying that these Caribbean governments are now becoming very tyrannical, where they're covering up information, don't want the population to know. They're talking about since June and only now, and it's just because the WHO decided to put their information online. In the age of information, nothing is being hidden. In the Barbados today, where they were seen concealing information, does nothing good for anyone. It says it's unfortunate that local authorities appear to have learned little from the communications failures of the COVID-19 pandemic, for as the country returned to normal, policymakers have returned to their old ways. Remember in the COVID-19, how they just covered everything from us, hid all this stuff? Over the past 24 hours, the public's curiosity has been piqued by reports of the World Health Organization website that there was a case of West Nile virus on the island and was reported in a child under the age of 15 last month. So basically, in Barbados, the only how we knew about it was because of the WHO. The government did not tell us that, hiding information. It was not the illness, which was relatively foreign to the island, had been uncovered that may concern many, but the information was circulating widely across social platforms for the world to see without a word from the Ministry of Health or other relevant body or agency. That's what I'm saying. And then when you discuss things like this, they say what? Malinformation, misinformation, disinformation, but they're hiding the real information. It was yet another example of information regarding public health not being shared with the public and the authorities being forced to divulge it following a leak. It would appear that those who have control and access to vital information that the public should be informed of still believe it's best to keep to an inner circle. Some governments say, oh, well, because we don't want to cause panic in a country. Well, keeping the information, having it circulated out there. And then when it's out there and people say things, you say it's misinformation, malinformation. So who's causing the misinformation? It's you doing it, not us. You're keeping the information from us. Here comes the WHO and expose you. And this is the only time now that you have decided that you want to go public. On September 13th, the IHRNFP for Barbados notified WHO of one confirmed human infection with WNV, which is West Nile virus. This marks the first detected human case on the island. This is on the 13th of September 2024. Remember, okay? We're now into October. The patient is a child less than 15 years residing in St. Thomas. On June 10th, the patient reported the onset of symptoms including headache, fever, vomiting, neck pain, and painful knees, and visited a private clinic on 14 June. A test for dengue conducted on the same day was negative. The patient was hospitalized at the pediatric intensive care of a hospital on 16 June due to worsening signs and symptoms, including joint pain and all of the other pains, right? So you're talking about something going on since June, and this is June the 16th now, the child is hospitalized. On September the 3rd, 2024, blood samples were collected and sent to the Mayo Clinic in the United States of America for West Nile virus testing. The presence of the West Nile virus antibodies was confirmed on the 4th of September. The patient is still under care and recovering. So you're talking about June, July, August, September. Now it's October. And this is the only time persons in Barbados are getting to know about this, and it's all because it was exposed by the WHO, it exposed the government. So while Mia was on the world stage gallivanting, here's how government hiding information from people, not telling the persons that we have a case of West Nile virus in the island. It was a child under the age of 15. And yet they're talking about people with misinformation, malinformation, and disinformation. They really should stop this kind of behavior now. It is time to stop it. The patient reported visiting a horse stable in February 2024 and a beach frequented by horses on 8 June 2024, 2 days before symptom onset. Although these exposures to horses were considered risk factors for WNV infection, the precise source of infection remains unspecified. So we still don't know what is going on in Barbados, because this is what they're saying. They're saying that she visited a horse stable, and although the exposures to horses were considered risk factors for the infection, the precise source of the infection remains unspecified. So we may have more cases out there and we don't know. No other suspected cases were identified. That's because nobody probably came to the hospital. But public health authorities continue to monitor the situation closely. But guess what? Only today, Ministry of Health came out with their information. We really don't care about the Ministry of Health. It's statement by the Ministry of Health on confirmed case of West Nile virus in Barbados. Well, you are late, but they say better late than never, but you really are late. The Ministry of Health has confirmed one case of the virus in Barbados. Communication relative to this was issued in surveillance bulletin number 38 dated September 27, trying to bring back themselves into the public domain to say, oh, it's September the 27th bulletin. We had that information there. Well, guess what? This was since June that individual was sick. It's really disgusting and disheartening to see what governments are still doing to us in the Caribbean. We should really not put up with these kinds of things. But we'll continue to monitor the situation. Remember, they said that, they still don't know where the infection really came from. So you never know. So be careful. Talk to you another time, Barbados.